Medically Speaking with Dr. Virginia Kane, where public health issues are discussed and designed to promote wellness by encouraging healthy behaviors, by gaining insight and awareness on how public health affects the health of our community.
Hello, and welcome to Medically Speaking. I'm your host, Dr. Virginia Kane, Director and Chief Medical Officer of the Marion County Public Health Department. Each week, it is my pleasure to host Medically Speaking and bring you the most current, up-to-date information regarding the health of our community. As you know, we are experiencing a COVID-19 pandemic. During this pandemic, the health department has been finding new ways to specifically reach the Hispanic Latino population. New data is showing that the number of cases in the minority population of Marion County is suffering a greater burden of COVID-19 infection across all age groups. The COVID-19 pandemic has created great fear and anxiety in our Hispanic families, as many face language barriers and have limited access to health care and health information. So in today's segment of Medically Speaking, we're going to address how COVID-19 is affecting the Hispanic Latino community disproportionately. Joining me for Medically Speaking today are Dr. Daniela Lobo, Assistant Professor of Medicine in the Department of Family Medicine at the IU School of Medicine, and Marjorie Duarte Sheffield, a health educator with Lead Safe Healthy Homes and Environmental Consumer Management of the Marion County Public Health Department. So stay tuned for Medically Speaking with me, Dr. Virginia Kane. We're back with Medically Speaking with two guests. We have Dr. Daniela Lobo, who's Assistant Professor of Medicine in the Department of Family Medicine at IU School of Medicine. We also have Ms. Marjorie Duarte Sheffield, who is a health educator with the Marion County Public Health Department in our Lead Safe and Environment Management program. So thank you both for being on the show. And I thought I might just talk a little bit about our data before diving into questions with you. First of all, since the epidemic started in March the 6th through August the 9th, we have found out that the Hispanic Latinx population has the highest number of COVID-19 cases compared to any other demographic group. That over 2,240 Latinos have been diagnosed with COVID-19 per 100,000 population, more than double the number of African American Black patients that we're seeing at 1,381 Black Americans per 100,000 population. With our Asian Pacific Islanders, the next third group, at 1,068 cases per 100,000, finally down to only 772 cases per 100,000 population are we're in our white communities. So when you look at the Latino data, they're nearly 3 times the number of cases occurring in this population. Again, the highest number of racial and ethnic populations with the most COVID-19 cases, 3 times the rate of our majority population, and twice the number of rates compared to African American Black patients. And if we looked at who's more likely to be diagnosed, it appears that females are more likely to be diagnosed with this COVID-19 than males of the same race and ethnicity. So our Latino women have the highest rates of COVID-19 at 2,433 per 100,000 patients compared to 2,000. So nearly 500 more cases compared for the females compared to the males. And then again, half of that, when we look at our cases in our Black American communities, we also find out that Black females have a much higher rate than their male counterparts, at almost 250 cases greater in our females. But once we get to the Asian Pacific Islanders, we see more males infected compared to females. But again, for our white community, we see more white females having a higher diagnosis. But let's look at the age group and breakdown of the Hispanic population that we're seeing. We're seeing that the greatest number of cases have occurred in the 40 to 49-year-olds for our Latino population. But the next group are 60 to 69-year-olds and our 50 to 59-year-olds. So a much older population and generation are we seeing our greatest number of cases overall since the epidemic started in our Latino population. But our demographics are changing in this last 30 days, and we're starting to see more a younger population between the ages of 20 and 29 and 30 to 39 now popping up with the Latino information. So Dr. Lobo, if I can ask you, why do we believe that the Latino population has the highest COVID-19 cases of all the different and racial and ethnic groups?
Thank you, Dr. for inviting me to be part of this important conversation. So I think you have to look at social determinants of health, including education, neighborhoods, and physical environments where this population lives, employment, social support networks, as well as access to healthcare, which has a large impact in the population health outcomes. Knowing my Hispanic community, and based on what epidemiology research has shown, increase in household occupants leads to a decrease in social distancing capabilities within the home. These are usually multi-generational households where you have small kids, young adults, and older adults all together under the same roof. And you often find 2 or more families living together.
Oh, wow.
Data posted in the La Plaza's website also shows that 60% of Hispanic adults and 17% of Hispanic children in the US lack health insurance. And I'm pretty sure that since the pandemic started, there's an increase in the percentage of those who are uninsured and underinsured, as many have lost jobs due to COVID-19. I was reading an article by Natalia Contreras in the Indianapolis Star, and this was posted just last week, showing data from a 2020 report by the New American Economy, which is a nonprofit immigration research and advocacy organization, outlining the key role that immigrants play in the local economy. In 2018, close to 112,000 Marion County residents were without insurance, and 34% of those were immigrants.
Wow.
Indiana, there are 14,000 frontline workers who do not have the option to stay at home. So at the same time, 34% of the immigrant community is without health coverage. So this combination heightens health risk for everybody and has a negative impact in our city's capacity to work through and recover from COVID-19.
So Marjorie, if you could you tell me a little bit about what you're seeing now in the Hispanic community, how COVID-19 is infecting our Latinx population?
Good afternoon. Thank you for having me here with you. What I have seen with the Hispanic community, the Latinx community, is what Dr. Lobo just mentioned. Yes, they need to work. They go out despite of COVID, and they live together. They don't do social distance because there are several people at the same time living in one household and maybe different other families. That is very difficult. They need to go to work. They don't wear masks, sadly. that's why we are doing a lot of education, because we want for everybody to be able to protect others. They go to work and their children are at home. They are not going to school. And parents are very, very worried because they don't receive the stimulus check. Most of them don't have unemployment, and they need to feed and support their children.
So let me just ask you just a little quickly, why is a significant number of Latino consumers or residents, why are they not wearing masks? Is it they can't afford it, or is it a cultural difference, or what? Any one of you can answer that question for me.
It could be they didn't believe in that, but now they are starting to believe it. Once it hits home, you start believing that this is a very serious case, that you need to protect others. One thing that we have been doing is educating, of course, and thanks to the Marion County Public Health Department and the city, we donated 4,000 masks. And we are always doing something for the community, giving away or sending them to other places that they can get masks. The mask is to protect others. So nowadays, I think people are understanding much better that is a need, and they are doing it a little bit better. Another thing that I haven't seen improvement yet, but I hope it does, is at the stores, people go there and they don't keep distance. We need to address this hardly with them, very, very strongly address the distance with people that go to every store.
So Dr. Lobo, I know that you see a lot of patients in your family practice and a lot of Latinx. Did your clinic stay open completely during this epidemic, or did you go to like telehealth kind of mechanisms? And if so, how was that received in the Latino population, telehealth? Did they have the tools in order to do that, or what?
Yeah, so initially, at the beginning of the pandemic, we had to close our clinic completely to all in-person visits. So we switched to telehealth, either by phone or virtual phone visits via Amwell app. So as we were able to open up gradually, and that was only up until maybe the last 2 months, we are now seeing in-person visits with a combination of the telehealth visits. I think the telehealth expansion has been challenging for many Latinx in the population of Latinx community. There's lack of information and education on how to use it. Many patients have not seen a doctor for now almost 6 months or more. So I think they need to get used to this new normal and unprecedented times, which can be challenging. Many adult and seniors in the Latinx community don't have a phone. Maybe just one family member carries a phone with them. They're not tech savvy. They depend on their children to help them with this technology, to help them with translating. So I think it's been challenging for our Latinx community for sure. And they'll think twice before spending on anything else before food or housing.
So we're going to take a break right now, and we'll be back shortly. Well, welcome back to Medically Speaking. I'm your host, Dr. Virginia Kane, and we have two guests here, Dr. Lobo and Miss Marjorie Duarte Sheffield. Dr. Lobo, who is our guest from Indiana University School of Medicine, a family practice faculty member who sees a lot of patients, and Miss Sheffield is one of our health educators at the Marion County Public Health Department. So Dr. Lobo, I want to know, are Hispanics likely to come in to seek health care if they are sick? And maybe you could tell us a little bit about any underlying conditions or something that you're seeing with the patients that are in your practice?
Yes. So we know that minorities have more uncontrolled medical conditions such as diabetes, hypertension, hyperlipidemia, heart disease, kidney disease, and liver disease. So sadly, minorities are more likely to have low wages, less access to healthcare, or it can be very limited. They also have fear and distrust of the medical system. There's the language barrier that they have to, navigate. They're trying to avoid high medical bills for sure. They have, this fear of the medical system, being involved with immigration system and risk of deportation, trying to avoid a public charge, which can affect their prospects of applying for legal status in the U.S. So many live paycheck to paycheck, and being sick is not really an option. So keeping this community healthy must be a priority for preventing of adverse outcomes in many different areas, and for the population in Indianapolis at large. So we would love to see more patients in our clinics, because we know they're suffering for sure. And patients have to decide, do I need to, pay for this hospital bill or pay for this medication versus pay for, again, food or housing or other home needs that they have.
I'm a physician, and I was even shocked to find out that if I went to the emergency room for a sore throat and I don't have any insurance, that bill is over $1,000 coming back to me just for a simple sore throat. If I
Yes.
was seen in an emergency room now, it's a lot more cost effective if you're in an urgent care facility where that bill might not be just a little bit over $100, but folks going into the emergency room because they don't have a primary care provider will be shocked if they have no insurance, because you're getting the full value of coming into a hospital system if you don't have discounted fees. So amazing things that people don't know until it happens to them. And then they're very reluctant because they feel they can't pay that bill back, especially if I'm laid off. I don't have a job. I'm concerned about being evicted from my apartment, and they don't know whether the stimulus money may come back or continue. So it's really, really interesting. So Marjorie, tell us a little bit about your program and how have you repositioned your program during this epidemic?
Well, my position as a health educator for the Environmental Consumer Management and Senior Care Program, I do a lot of outreach and education, but specifically for the environment. However, all of us have been moved to different tasks, and one of those is to educate and assist the community in need with COVID information. It has been challenging for everybody. I love this job because I can reach out and give information that is needed and is very useful. People in the Hispanic community, they don't trust everybody. And that has something that fortunately I have gained over the years, their trust. And I don't want to disregard that I also have my flaws, but I'm working for them. I'm here for them. And I go out, I give them all the information, I give them resources. For example, they can call to the Immigrant Welcome Center, and they are going to find resources in there that are very useful. They don't need to have money to see a physician. Sometimes they can give them, the natural helpers can give the information to them. La Plaza is another wonderful resource for them, for everybody.
It's a it's a social service agency, right?
Yes, they can do that. And also the Marion County Public Health Department has the sites for testing, and people, they can call us and we can fill the form and we call them, give them the appointment, and they come to the sites to get tested. And those are free. They don't know that. When they learn those tests are free, it's a relief for them. We go out, not only me, We have many, many people that speak Spanish, and this is not only for the Hispanic population. We have Burmese, we have French, Africans, and all of those people are learning through us that they can be served within the Marion County Public Health Department.
So thank you. So Dr. Lobo, you know, the data has shown that more females are getting infected than their male counterparts. Do you have any reason why that is the case?
One thought I had is females are more likely to be caregivers in the home for not only older parents, but also all family members. And if this female household member has to also be the breadwinner, she has to go out and work either part-time or full-time, she can expose other family members as well.
So let me just say for both of you, what continues to be a major issue in the Latinx community? You know, what would you like to see more of? Dr. Lobo or Marjorie, either one, I'll let you, whoever wants to go first.
Dr. Lobo?
Yeah, I would say for those patients who have healthcare coverage and have an established medical home, reach out to your primary care office, make an appointment if you're not feeling well, or if you have any questions about testing or concerns. Many clinics in the city count with resources to guide you. Also, for those who don't have insurance or are underinsured, there are many clinics and urgent care centers across the city that Eskenazi Health provides for patients to access, many with culturally competent and bilingual medical doctors, nursing staff, and ancillary staff. So I would say reach out for those community resources like Marjorie was mentioning as well.
I know a number of federally qualified community health centers like Ashkenazi, HealthNet, Shalom. So many of them have received some COVID-19 dollars for care as well as for testing. So, and I'm sure your clinic as well too, Dr. Lobo. Marjorie, any last remarks or anything you think we need to do more of?
I would like to request to the population, wear your mask and be practicing distance. Avoid crowds. And if you need to call me, there is my phone number, 317-221-5921. 317-221-5921. I can help you. If I don't know the answer, I will find it for you.
So let me just thank both of our guests on behalf of Medically Speaking. And I want to thank everyone for joining us today. Hopefully you've been provided with some very important, helpful information. First, how to prevent yourself from getting COVID-19 or your loved ones. But we want to keep you and your family safe. So thanks again to our guest, Dr. Lobo, Miss Marjorie Sheffield. I am Dr. Virginia Kane, your host for Medically Speaking. Join us again next week.